I am so excited to be here with board-certified, world-renowned plastic surgeon, Dr. Michael Epstein. He is known for facial rejuvenation and is the go-to guy, anything above the neck for sure. And today we are going to deep dive a little bit further into facial rejuvenation and facelifts. So tell me, Dr. Epstein, what is a facelift?
Well, first of all, Laura, welcome to my home away from home here.
Oh my gosh, where are we? I didn't even think about that.
We're in the operating room, and a place where I like to spend the majority of my time. In answer to your question, what is a facelift? Well, you know, a lot of people think that what we're doing is we're just kind of, lifting a little skin and pulling it back and tucking it in, right?
Yeah.
And actually, it's a little bit more complicated than that. What we're really doing is elevating the skin to access the soft tissue underneath that skin, which really, that's the part that's drooping down, right? That's pulling the skin downward and creates the little jowls that we have, the loss of definition of the neckline, in even some of the extra skin in the neck. And so by lifting up the skin, I can access that soft tissue, reshape the soft tissue, reshape the face, and that creates a little extra skin, and then we just clip that off. And that makes for a much more natural look to the facelift, and it actually helps the scars heal in a much better way too. So.
How many of you just touched your neck and lifted your jowls up? I know that's what I wanted to do when he was saying all of that. So let's get a little bit more into it then. So I'm sure that there has to be many different ways to perform a facelift. So talk me through the procedure, and are there different techniques?
Well, of course, there are different types of facelifts, and I do several different types, and it really depends on what the specific issues are with the individual that you're working with, right? What is the patient presenting with, and if it happens to be their upper face, then we're talking really about more of a brow lift or the upper face lift, right? If their brows are pushing down, which can create some extra skin around the crow's feet area. And then when you start to get to the middle of the face, sometimes you start to see those dreaded nasolabial folds, or the heaviness of the jowls that are hanging over the top of the jawline. That gets us into doing more of a mid-face lift. Some people call it a deep plane. And then along with that, we're also lifting the neck and rejuvenating the neck too, because oftentimes when the face is dropping, it's creating a little extra skin in the neck area, and we take care of that all at once.
Sounds beautiful. So here at Concierge Aesthetics and Plastic Surgery, we are a full-service aesthetic practice. Not only do we have this man's magic hands, we also have a team of nurses, estheticians, nurse practitioners that can perform non-surgical treatments like Botox and derma fillers, Althera, lasers, anything you could possibly think of. I guess my question for you is at what point or when should a patient say, hey, that can't help me reach my goals and it's time for a facelift?
The quick answer to that is when the nurse injector or the esthetician sends them my way.
There you go. There you go.
But the real, that also is a good question, because when somebody comes in to me for a consultation and they're interested in a facelift, I'm evaluating their whole face, both outside, inside, up and down, and I explain to the patient that really as the face ages, it's sort of a three-part play, if you will. There is, of course, changes in the character of the skin that often occur. There's changes in volume, and of course, there's gravitational change. And oftentimes, we can, in the med spa, we can take care of, rejuvenate the skin, and we can certainly add volume with filler. But when it comes to gravitational change, what's really happening as the soft tissue in the skin is dropping, there's not a whole lot that somebody in the medical spa or the non-surgical world can do. And that's where I step in. And that's what's great about, this sort of, circle of care that we've got going on.
Exactly, because even after the procedure, they're going to need to still come to the med spa.
Right.
So I guess too, my next question for you would be, what's the recovery time like? Like what can a typical, and I know everyone's different, but on average, what can they expect in recovering from a facelift?
It's actually easier than most people think. Facelifts, today, are very, very different in terms of the recovery process than how they used to be, 15, 20, 30 years ago. And a lot of that has to do with, many of the types of things we're doing to set the facelift up ahead of time. The type of anesthesia, for one, it's a mixture of local, which is really shrinking some of the blood vessels along with anesthetizing them locally, and the anesthesia that's given by one of our board certified anesthesiologists here. And so the recovery process can be much quicker because there's a lot less swelling and bruising. So a patient can look pretty darn good, and I tell patients they could be out in about a week and a half to 2 weeks and really look pretty good.
So I guess another question that everyone always wants to know, and I am often asked, is a facelift permanent?
So there's, it's a tricky question.
I like to ask those.
So, of course, nothing really is permanent as long as we're alive. You're continuing to age, right?
Agreed.
But how I explain to patients is, you can think of us as being sort of on a conveyor belt of life or conveyor belt of aging. And really what this facial rejuvenation surgery is doing, or a facelift is doing, is sort of like, as things are moving, I'm sort of picking you up off that, conveyor belt and putting you back. Okay. But it's still moving, right?
Gotcha.
The truth is, though, it's permanent in the sense that you're always going to look better than you would have had you not had it done, right? Because think about the conveyor belt. If you didn't have it done, you'd be way out there.
Yeah.
So
I like it.
Yeah.
That's awesome. Is there anything else that you think we should know about facelifts that we haven't covered?
Of course, any surgery comes with its share of risk of complications, and you also need to understand that there are also side effects, most of which are temporary. For example, patients tell me that initially, how they have sort of a numbness feeling around, where the incisions are, the front of the cheeks and neck area, and that goes away pretty fast. Yeah. Within weeks to a couple months, most, if not all, of that numbness is gone. And the risks that we see with this are pretty similar to just about any surgery. And it's just really important that a patient understands that we take this seriously. I mean, this isn't like going to a salon. I mean, this is real surgery. And we treat every patient with care and really do our very best at minimizing those risks of complications.
I love it. Well, Dr. Epstein's team is nothing less than exceptional and amazing, and they will hold your hand through this whole process. So I think you need to call and book your consultation and meet Dr. Epstein and his wonderful team for a facelift today.